But if the standard is saving only one life, then it doesn't matter if it's contagious or not. And the thing is, nobody lives according to the if we could save only one life thing. The lockdowns cause other deaths, and those deaths are just as important even if you didn't know those people. Other people's lives matter too. In April, the United Nations warned of hundreds of thousands of child deaths and the reduction of somewhere between 42 and 66 million children to extreme poverty as a result of the complications emerging from the lockdowns. Do those people's lives not matter? By the vice chairman of the American Psychiatric Association's Council on Addiction Psychiatry, I've been seeing this in practices, and my colleagues have been talking about it too, people suffering because of social isolation. And that addiction patients are relapsing, and a lot of patients who don't have drug use or alcohol problems are drinking more now, sometimes every day from 4 or 5 p.m., and they don't stop until they sleep. And UNICEF predicted 1.2 million child deaths as a result of the lockdowns. So it's not just either or. Well, either we have the lockdowns and people live, or we don't have them and everybody dies. There is a superstitious reverence for so-called experts that manifests itself in the expectation that they can answer all questions. Not simply the questions they're trained to answer, but they have a holistic view of the world, and they can really answer all questions. And then we're told, listen to the science. But we have to understand, what is science? Science is not a series of infallible statements. That is absolutely not what we're dealing with. It's an ongoing search for the truth. So the science has been all over the place in this crisis. They're presumably trying to get a handle on what's going on. So simply to say to me, listen to the science, well, okay, if I listen to the science, I'm constantly getting different answers to how does the virus spread, how does it not spread, what is the role of children, do children get it, do they spread it, do they not spread it, do asymptomatic people spread it, do they not spread it, what about pre-symptomatic people? Is Sweden's approach a good idea? We were told, no, it's terrible, everybody's going to be dead in Sweden, and then we were told by the head of the Health Emergencies Program of the World Health Organization, Sweden's avoidance of a lockdown was a model, we were told, by the science. Why are some countries doing so much better than others? So the science told us that Japan should be a giant graveyard. And the ghouls were practically rubbing their hands together in anticipation at the Japanese getting what they deserved because they didn't listen to the science. And it's almost like there's something more than just science motivating these people. And none of that ever happened. Japan did fine. And then later they said, well, it's because Japan wore masks. They knew Japan wore masks when they were predicting they were all going to be dead, so nice try, bozo, to bring that one up at the end. Or whether lockdowns work. I mean, well, show me. So I'm supposed to listen to that? I mean, I'll do my best to be informed, but it's not like there's some infallible answer that we can all be listening to at a time like this. And then, okay, then we get told, well, why don't you talk to healthcare professionals? They'll set you straight. They'll tell you ought to shut up and listen to Dr. Fauci. But even they have differences of opinion because, believe it or not, even healthcare professionals have political ideologies. Now, I liked this statement. This came from Dr. Stephen Shapiro. He is the Chief Medical and Scientific Officer at the University of Pittsburgh Medical Center. COVID-19 is a disease that ravages those with pre-existing conditions, whether it be immunosenescence or of aging or the social determinants of health. We can manage society in the presence of this pathogen if we focus on these pre-existing conditions. And now here it comes, the health consequences of lockdown. What we cannot do is extended social isolation. Humans are social beings, and we are already seeing the adverse mental health consequences of loneliness, and that is before the much greater effects of economic devastation take hold on the human condition. In this particular case, the problem we're not going to be able to fix in the short term is the complete eradication of the virus. The problem we can fix is to serve and protect our seniors, especially those in nursing homes. More people over age 100 than under age 30 have died, which is quite interesting. And even Neil Ferguson, who was responsible for the major UK model of the virus, predicted that somewhere between 50% and 2/3 of all people who would go on to die from it would have died in 2020. That's how sick they were. masks will solve all our problems. Why is California having a spike? I don't even know the science behind masks. Maybe they do work. Who even knows? But the point is, the Connecticut governor is saying, well, the reason we flattened our curve is because of masks. I'm pretty sure the science doesn't say masks work in California, masks work in Connecticut, but they're a big stinking failure in California. I mean, obviously there's something less cartoonish going on that we haven't fully got a handle on. A professor at Waseda University, Mikihito Tanaka, had the guts to say, when asked, why has Japan done so well? The answer was, even experts don't know the reason. How about that? Now, on Twitter, they all know the reason. It was masks. They all know the reason on Twitter. Or if you post this on Facebook, all your Facebook friends, they all know the reason. The experts are stumped, but they really should get on Twitter more, because then they would know what was causing it. I just don't see what's so hard about admitting we don't entirely know what's going on. Let's just be honest. We don't entirely know what's going on. But there are people who think they know. They think that if students return to school, this is going to lead to piles of corpses. In Germany, Saxony was the first to reopen schools after the lockdown. The result was no hotspot whatsoever. And after the summer break, they're even going to drop the mask requirement. So this has actually been tried. There were 7 states that had minimal to no lockdowns. And you look at what are the expected number of deaths that you would expect to have in these states by this time of the year. And every one of those 7 is way below, or is at least significantly below, or somewhat below, the expected number of deaths. Then we look at the 7 most heavily locked down states, and 5 of those are above the expected number of deaths, and several of them way above the expected number of deaths. So again, now there could be other factors at work here, but it's not just a glib response that on Twitter you could give in 280 characters. There's something we're not quite fully getting about this. And it's not entirely just population density either. Stockholm did better than New York City, it even did better than all of New York State, despite being 2.6 times more dense. Sweden, of course, is the country everyone used to love. Everybody loved Sweden, whatever it was. IKEA's from Sweden or something. And then they loved the social democracy and all that. And then that just stopped. They don't like Sweden at all. So, okay, so they say Sweden didn't do as well as other Scandinavian countries. And yes, its nursing homes were hit very hard. But one thing that is interesting to note about Sweden is it's a country of 10 million people. How many people under age 50 died from the virus in Sweden? Under age 50. 70. That's an astonishing number. So now, and incidentally, it's not enough to say, well, Denmark and Finland did better than, If the virus justified this mad, irrational destruction of the past 4 months, and who knows how many more months, Sweden should be 1,000 times worse than everybody else. Not comparable to the UK. It should be 1,000 times worse. There shouldn't be anybody left. Ferguson's model said there would be 96,000 deaths by June in Sweden if they didn't have full suppression. By that date, they had about 4,000 deaths. So they beat that by a factor of 24. So that's worth noting. There's other things we can say about Sweden. I mean, we also know the Swedes kept sending kids to school. Finland, they didn't. And then it turns out there's no difference in the health outcomes whatsoever. None whatsoever. Now, obviously, it makes sense to take precautions, and particularly people who are vulnerable, especially vulnerable. There are precautions you can take. They're improving treatments all the time. These are all things to be welcomed. But the issue is, if we just simply say, let's just try to have a blanket protection of absolutely everybody, this is not the best, it seems to me, use of resources. It'd be better to focus the resources on the most vulnerable people and let the other folks try to live their lives the best they can, at the very least to keep the engine of prosperity going that allows us to support the vulnerable people in the first place. And we should talk about how to best preserve biological life. But the bigger question that needs to be answered that I hinted at the beginning is whether mere biological life is worth living. And no expert can answer that question for you. because it's a philosophical question. So if people's hopes, dreams, and aspirations are dashed for an indefinite period of time, which purveyors of the current strategy almost flippantly propose, we'll just stay shut down. Is that really living? They say probably no large gatherings for a long time. Okay, well, how long? Just give me an estimate. And what are large gatherings? Oh, no big deal, just concerts, theater, lectures, church, sporting events, the arts in general, pretty much everything that makes life worth living. So yes, this kind of life has a pulse, but it has no soul.